Hello, everyone. Thank you so much for joining me tonight for YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And tonight we're going to talk about drugs. Now, drugs are ever present in our society, right? And so I just want you to know that I read four distinct headlines about a week and a half ago that really struck me. I said, I have to talk about this. So let me just read you the headlines. Pfizer vaccines associated with hearing loss, antibiotic use, and cognitive decline. PPIs, which are protein pump inhibitors, are linked to Alzheimer's disease, metformin use, and birth defects in male offspring. Just that was just in 1 week, all four of those. So, but before that, I want to talk about this topic, and I'll tell you why. Because the one subject I thought was really important was that the risk of omega-3 fatty acids or fish oil and atrial fibrillation that came about a few months ago, and also the risk of low dose aspirin and bleeding. So it's really important that we talk about this. Now, are drugs bad? Some people would like you to think that. I'm very active on Instagram, and a lot of people in the functional medicine world, some of whom have quite a big, huge following, are very negative on doctors and what we do in medicine. Now, here's one that I read. This is a recent post from a very popular chiropractor on Instagram. And I quote, if doctors stopped prescribing meds and instead started fixing people's diets, many chronic diseases would disappear. Now, who believes that? First of all, and I wrote back saying, well, I am an integrative cardiologist practicing functional medicine, and I do deal with diets every day with my patients. But there are a lot of patients in the cardiology world that are beyond just lifestyle, or they have an embraced lifestyle. So I'm not an elitist. I can't say I will treat you. And lots of times I have to use medications in these patients. And, in general, medications can be life-saving and also life-altering in so many people. So I'm against negativity here. At the same token, what do you do when you read this stuff? When you read these headlines, they're kind of scary, right? So my take-home message to you is always consider the risk-benefit ratio. Okay, so if the risk of ingesting something or having something injected into you, if the risk is greater than the benefit, then you got to think twice about it. It always boils down to the risk benefit ratio. Now, let's talk about these four these in detail. Okay, so Pfizer BioNTech vaccines. There's a rare association with hearing loss. It was reported recently. So the World Health Organization has investigated this, and it seems primarily with the Pfizer vaccines. So there's been like 11 billion vaccines given worldwide. Okay. So they reported 164 cases of hearing loss worldwide. Uh, now, and there, besides that, there were like 367 cases of tinnitus or tinnitus, which is a hearing condition like buzzing in the ears, humming in the ears, which really interferes with people's lives. So 80% of the reported tinnitus cases developed after the vaccine. So the average age was 47 years old, and most were healthy with no previous condition. That's of hearing loss. And of the tinnitus, 48. And 75% of these people were women. And a third worked in healthcare. So what do you do when you hear these stories? Well, again, it's the risk benefit ratio. And if the risk of developing hearing loss or tinnitus is pretty low when you consider how many vaccines have been given. And we still believe that vaccines are a key to stopping the spread of COVID and certainly the severity of disease in COVID-19. So, of course, if you're one of those people that suffers hearing loss or tinnitus, um, it's a bad thing. So, it's you have to make your own decision, and that's what I implore people to do as their own medical advocate. Number two, new PPI data again link medication use to Alzheimer's. Now, PPI are protein pumps inhibitors. So it's like Prilosec, Nexium, Prevacid, those things that are given out all the time by primary care doctors and also gastroenterologists for heartburn, um, acid reflux. They're very commonly given. But I want you to know when these first came out several years ago, they were really indicated for like, if you look at the product insert, for like 90 days. Okay, how many people are on these? Like always, they never get taken off. So it's a major concern because I am not a strong I'm not in strong favor of this medication. I rarely, if ever, even recommend it, or a lot of them are now over the counter. Um, so this is not new. This is a Korean study, and I don't really have the details, but they did find that there's an increase in Alzheimer's disease regardless of current or past usage. Okay, and whether you use first generation, such as Motrin, ibuprofen, Advil, or I'm sorry, name mistake there, of Provicid or Prilosec, or second generation ones that are out now. So it's um, it's a really again a risk benefit ratio. I am not in favor of these drugs, but they are helpful in several people. I think there are alternatives, and as a medical advocate, that's what you want to explore, the alternatives. Okay, number three, antibiotic use in middle age ups the risk of cognitive decline. Now, this was a new study published in March 23rd in PLOS 1, suggested that prolonged use of antibiotics in midlife is related to cognitive decline several years down the road. So it's not like it's something you see immediately. This is a self-reported study, and they studied 14,000 nurses. And those that used probiotics for at least 2 months out of 4 years tested positive for cognitive decline 7 years later. So the question is, do antibiotics actually cause damage to the brain, or is it disruptive on the gut microbiome? And I think me and a lot of people in functional medicine would think that it's a disruption of the gut microbiome that perhaps could lead to this. In fact, they've done research on mice that have shown that antibiotics such as ampicillin, which can be undetectable in the brain, has been shown to be linked to gut dysbiosis or leaky gut and cognitive impairment. So interesting. Uh, Next, and metformin prescriptions linked to son's birth defects. Now, metformin is probably the most widely used medication for diabetes and metabolic syndrome. And I happen to like this medication. It's one of the few medications I actually advocate. But there are drawbacks to this, like everything else. So they found out that men that took metformin 3 months before conceiving children had an increased risk of their sons, not daughters, sons, having birth defects. This is a Danish study, and it was retrospective, looking at birth registries from 1997 to 2016. And what's so special about 3 months? It actually takes 3 months for sperm to mature. So they found that 1.1 million children studied, 3.3% had at least one birth defect, but 4.6% among sons of metformin users. So we don't know why. Is it the effect of metformin on the sperm? Who knows? It's too early to tell. But the take-home attention is we need to really spend more attention on paternal health. We think about paternal health, we think about maternal, but if a man wants to conceive, I think he really gets his partner pregnant, and he's on metformin, he may want to think twice about that, at least for that 3-month period. Now, besides those four studies, there are a couple of things that I think are really important in the headlines in the last several months. High dose omega 3 or fish oil with a link to atrial fibrillation. This really concerned me when it came out because I'm a big advocate of fish oil. In fact, I would say most all my patients are on it. It's probably, of all the supplements out there, it's probably been studied the most. So, in fact, in 2019, the global market for omega-3 fatty acids or fish oil was 4.1 billion. It's expected to double by 2025. So it's huge. And it's belief by many that omega-3 fatty acids are beneficial to your health. But I want to read you what JAMA recently said. Although the health benefit, and I quote, although the health benefits of these products remain questionable, it's important for consumers to take them to understand their potential risk. I definitely believe in knowing the potential risk, but they're still questioning the benefit. And this is traditional medicine because you're basing it on their standards. But I think most of us really feel that there's so many benefits to fish oil. It's unequivocal as far as I'm concerned. So, four different trials in the past suggest, but didn't prove, that there is a dose-related effect on developing atrial fibrillation with the use of fish oil. Certainly, once you get like 4 grams or higher. So, Circulation just recently came out in October actually not recently, but a few months ago in October 21 came out with a study that was actually done from Cedar Sinai. It's a retrospective study looking at 7 different trials 81,000 patients. The mean age was 65. 39% were women. And they found that there was a 25% increase in atrial fibrillation in those taking greater than 1 gram. That's huge, right? So and they also found that, well, if you take like 1.8 grams, it's not really statistically significant. So for some reason, they go from 1.8 to 4 grams, and 4 grams, they found that there was difficulty, and there's a 25% chance of contracting atrial fibrillation. I will let you know that I've never seen it, and I deal with atrial fibrillation every day of my life. So first of all, how do you take this? It's meta-analysis. It's pooled data. They don't take into consideration things like age, blood pressure, diabetes, obesity. They don't take into consideration any of those comorbidities. So it's just suggestive, but doesn't prove that that taking high dose fish oil will lead to atrial fibrillation. And I want you to know, they mentioned the word 4 grams, but there's 2 pharmaceuticals out there, Vascepa and Lovesa. And those are comprised of EPA, which is one of the strong fatty fish oils. And that particular products are used to decrease triglycerides. You actually need 2 grams twice a day. And it's approved for high triglyceride and also as an adjunct to improve decrease death from heart disease. So those are 4 grams, and that's recommended, and they're approved by the FDA. So I find that interesting. So the jury is still out. I would say I would be more worried about things like alcohol causing atrial fibrillation than I would fish oil. And I think most of my patients probably take about 2 capsules a day, which is 2 grams. That's close to 1.8. I really don't think you're going to see too much atrial fibrillation in people taking that dose. Although there are times in which you want to use bigger doses. Like I said, with those patients taking the 2 prescribed pharmaceuticals for decreasing triglycerides. The other thing I want to mention briefly is the aspirin controversy. For years, doctors were giving patients baby aspirin, 81 milligrams daily, basically anyone over age 55. Now, I have never been to that school. Even before these studies came out in the last year or so, I always personalized who should get aspirin, baby aspirin. And I think it's pretty unequivocal if you've had a heart attack or a stroke, or you've had a stent or bypass surgery, or if you have peripheral artery disease, or carotid artery disease, it's probably for sure the benefits are going to outweigh the risk there. But so again, I do not believe in getting, and this is from the U.S. Prevention Task Force services that came out in this fall of this year. So if you've never had a heart-related problem or an event, you shouldn't be on aspirin. Or if you have an increased risk of bleeding, like right? That's pretty much for sure. So again, it boils down to whether you're at high risk for a heart-related problem. Now, I will tell you that I go a little bit beyond that because I do a lot of coronary artery calcium scans, which tells me if there's indeed coronary disease. Depending on the risk factor profile and the coronary artery calcium scan, I will probably oftentimes give a baby aspirin. But it's individualized according to the risk factor profile in a given patient. So again, it just boils down to knowing your risk, and the risk-benefit ratio. If the benefit outweighs the risk, you consider doing it. If it's the other way around, you got to think twice. And that's what we do as medical advocates. We ask questions, we do our research, and we do whatever we can to stay in the driver's seat as it relates to our health. So with that, I would like to take some questions. So let me get my glasses on here. And okay, what concerns me the most about the vaccines are the reports of impacts on the heart, especially those damaged or diseased hearts. Okay, I really don't. That's a good question. Thank you very much. I don't think that is as big of a question as you may think. First of all, the people that did the worst of myocarditis are people that actually contracted COVID and ended up in the hospital. So let's say 20% of those that have COVID end up in the hospital. These patients have a very high incidence of myocardial involvement or heart disease, and they're the ones that do very poorly. As far as the vaccine-related myocarditis, it was generally been found, and it's still pretty rare, but it's seen in young men, actually teenagers, 13 to like age 28 or 30. And all these men recovered quite well quickly without any untoward effect, any long-term effects. So I don't think that should be the reason to not do a vaccine. There should maybe other reasons, but I don't think taking a vaccine is going to hurt a pre-existing cardiac condition. I recommended vaccines in all my cardiac patients. Some took it, some didn't, and that was their business. But I don't think that in itself is a reason to not vaccinate. Okay, question number. 1 minute they say take this metformin, and all of a sudden they say don't take it. What should you do as a layperson? Again, what are the benefits of taking metformin? It's the most widely used drug in diabetes. It's also very useful in metformin and metabolic syndrome. And as we've discussed before in previous programs here, 88% of the adult American population is metabolically unhealthy. Doesn't mean I rush to metformin. I always go lifestyle first, diet and exercise. I exhaust those. But there is definitely clearly a role for metformin in that. Metformin also has some other unique properties. It increases this enzyme called AMPK, which is actually very useful in longevity. It also has some anti-carcinogenic effects. So it's useful, but it has drawbacks. And so this whole thing about what it can do to maternal health, and this is new to me, new to all of us. It was a Danish study, so I think we need more information about that. But again, I think the benefits of taking this medication in most people outweighs the risk. Of course, it can cause diarrhea and GI symptoms. So some people just can't tolerate it, and other people that have renal insufficiency or kidney disease are unable to take it. It can affect that. So that's what we know about those. Okay. Thank you, Angela. Okay. Other questions? Any other questions about specific drugs? Because you hear about drugs all the time. Okay. How do you know you have quality fish oil? Good question. Um, you don't really, well, first of all, I'm really snobbish about two kinds of supplements. One is coenzyme Q10 and one is fish oil. And I'll tell you why. So you want fish oil that is good quality, meaning it should be from a manufacturer that actually uh, that that really has at pharmaceutical grade. So all supplements, as you know, are not really, or they're not approved by the FDA. There's no regulations on them. So what's on the bottle may not be what you're taking. So that's why you want to stick with a company with high reputation and pharmaceutical grade, which is what I generally sell in my office. So you want to avoid. I don't go to Costco or Trader Joe's for my supplements. I want quality supplements, so I generally choose those of reputable companies. And you have to eventually trust it. But like the supplements that I sell, my own particular supplements have been tested, which means what's on the bottle is what you're taking. So, but it's not that way for most. So you have to be careful. So that's a good question, and it's a timely question. Okay, let's see, Joanne. Any new medications you're excited about? Good question. Actually, yeah, it's really funny. I'm going to mention two new medications. I don't know if I'm excited about it. So, with high cholesterol, we've been using statins for years, and they have their role, but some patients can't tolerate them. So then we go to this new class of drugs called PCSK9 inhibitors, which is an enzyme. It's on the LDL receptor in the liver, and it actually can drastically decrease your LDL or allows your cholesterol by like 55 to 60%, which is amazing. Now they're coming out with a brand new one that just was approved, in which you can take it every 6 months, and it lowers your LDL by 52% actually. It's a new medication. I have been here. It starts with the V. Let me see. I don't see it right now. I've been studying it a little bit, but first of all, no one's going to pay for it. It's going to be probably more expensive. And but the advantage of taking something every 6 months by injection, it works differently. It works on messenger RNA, and it's a step ahead of the PCSK9 inhibitor. So I'm excited about that because the science is so interesting. Everything is about mRNA now. Another drug that's being investigated, and they're doing it at UCSD, I believe, is a biologic that will be helpful to decrease LP little a. And if any of you have listened to me before, you know that Lp little a is a major risk factor for heart disease. It's genetic. It's not it's not altered by diet or exercise or lifestyle. And the only thing that's been shown to be helpful really is niacin, which doesn't work in everybody, but I have had success with niacin and also CoQ10 in very high doses. So those are two things that I'm interested in. Um, Other new medications, and since I usually stick to cardiology, medication wise, that's about it. They're the two that really excite me. There are some new ones for heart failure and pulmonary hypertension, which I don't use in actually, there is a new one for heart failure that I am excited about. It's if you heard of SGLT2 antagonist, so like Ozempic you've heard of, not so, that's one of them, and Victoza in the past. I'm sorry, I made a mistake on that one. No, I'm talking about um, I think that they have a mind blank right now, but stick with me. One is Forxiga and Jardiance. Okay, Jardiance has been studied the most here. So those are drugs that are used to excrete sugar from your system. So you actually you pour out sugar from your system, which can help decrease sugar and also help your diabetic situation. However, it's also been shown to be very protective against heart disease and also renal. It could be renal conserving and cardioprotective. So it's been shown to be very helpful in preventing heart. It's a new drug to put on the block for treating of heart failure. And the good thing about it, it doesn't decrease heart rate or decrease blood pressure. A lot of the heart failure patients suffer from low blood pressure to begin with because they have a weak pump. So that's pretty exciting that was just approved in the fall for treating heart failure. So that's pretty exciting. Okay, let's see. See, did I miss anything here? That's a good question, though. There are probably other new exciting drugs in the market. Um, as far as diabetes is concerned, I treat a lot of diabetics because of the nature of my business as a cardiologist. But I really focus on lifestyle and these newer agents. I don't use the old agents like the oral hypoglycemics, the sulfonylureas. They actually caused weight gain, increase in insulin, and also made people very hypoglycemic. So I'm excited just about using these drugs in diabetics. But when they need insulin, okay, which is sometimes happens, sometimes they just burn out their pancreas from being so, the insulin resistance and the metabolic syndrome. Then I send them to an endocrinologist because I don't specialize in insulin. There's many different forms now, and I don't keep up with it. So anyway, okay, what do you think of, put my glasses on for this one. For nootropics, I'm interested in experimenting with something that will improve my cognition, especially at my age. You know, I'm not terribly impressed yet. There may be a real benefit of these particular supplementation. So, as far as maintaining your cognitive ability, first of all, everybody should know their ApoE genotype. That's useful to know because is there a genetic basis for Alzheimer's? That's nice to know. And you can be APO3/4 or APO4/4, which is the worst. So if you're APO3/4, you have one good allele, one bad one, you're like 4 times more likely to develop Alzheimer's. If you have APO4/4, you're like up to 12 times more likely to develop Alzheimer's. That does not mean you're going to have Alzheimer's, because when it comes to genetics, and this is really important, people, is that 20 to 30% of our outcome really depends on genetics. 70% plus depends on lifestyle. So you can beat your genetics. And that's what's important to keep in mind. So what do I do in terms of the nootropics are concerned? I think one of the most important things is activity as you get older, because activity increases blood flow to the brain. That's one of my first things. And then fish oil is very useful, especially DHA. So I talked about EPA for triglycerides, but DHA is very good for the heart, vision, and brain. So I use fish oil for that. CoQ10. So there's a lot of products that you can use. Dr. Dale Bredesen, who's probably one of the foremost Alzheimer's experts, he has proven in a very small study that you can reverse early Alzheimer's with his program, which involves like 20 different supplements. But so it's not a field that I know a lot about, but it's exciting. And that's exciting that we can even think about that, because you hear about people in cancer having remission. You think about people, all the time, right? But how many people in the Alzheimer's have a remission? I mean, they all get worse, right? So it's very, and the drugs don't work. And that's one time I don't really endorse the drugs at Alzheimer's, because they have lasting side effects and they only treat the symptoms. They do not alter the progression of the disease. So as far as the nootropics are concerned, like there's so many on the market. I don't use them, and I'm of the age at which I need to be concerned about my cognibility. I forget things. I forgot a word today. I forgot one of the medications. It happens as we get older. We start forgetting names and things like that. It's very frustrating, because I'm pretty good on facts, but sometimes I miss names. So it happens to everybody. But I think staying active, taking fish oil, magnesium is also very good for the brain, especially if you take a magnesium prep that actually goes through the blood-brain barrier. And that's basically magnesium threonate. That is the oral magnesium really won't do it, or regular magnesium. So that's how I feel about those. Okay. Any other questions, guys? I'm looking here. I don't see anything else, and I don't have any other questions in my mind. I thought for sure people would be asking about these things. But okay, well, I guess we're going to end early tonight. So let me tell you about next week, or actually 2 weeks. So, oh, good. I got one. What do you think of? Let me see. Okay, give me a second. Magnesium threonate, threanate. It's a component of green tea, actually. So, but magnesium threonate will actually cross the blood-brain barrier, which is really nice. So besides getting a good night's sleep, it does help. I use that in a lot of my elderly patients, the patients that have early cognitive decline. I have them start off with a teaspoon. It's a powder before they go to bed, and then if they do well with that, I'll add another one midday. And I've had some success with that. And also acetyl L-carnitine is good for the brain. So there's a lot of different supplements out there that can be useful for the brain. But I haven't gone to like Pravagen or whatever that's what that they advertise on TV all the time. My thing is, if it sounds too good to be true, it probably is. So in 2 weeks, we're going to talk about stress, and I wanted to do it this month because April is Stress Awareness Month, but I couldn't quite make it because I had a technical difficulty last week, so I'm a week behind. But we will do it in the 1st of April, because 2 weeks from now I'll be in Richmond, Virginia, attending high school reunion. I won't tell you which one, but anyway, so I won't be here. So it'll be 3 weeks, and it'll be about stress management and some of my techniques that I use. So I guess that's it then. I thank you for your attention, and also I'm also very proud to announce that my book will be coming out in a few weeks. It's it's going to be coming out. It's about really becoming a medical advocate, and it's entitled "From Both Sides of the Table: When Doctor Becomes Patient." And I actually was hospitalized twice in a 17-month span a few years ago for two unrelated reasons. So it was about my journey, how I had to step up to the plate and become a medical advocate. But that's just my story. It's really about you and how people can become their own medical advocate. So anyway, it will be coming out, and I will be announcing it here. And great. Let me see, I got everything. All right, guys, thank you. And we'll see you, I guess, in 3 weeks. Okay. Thanks for coming. I really appreciate it. I'm very grateful for your attendance. And please, if you look at any of my videos, please check that like button. It helps my ratings. Okay. Thank you. Good night, everybody.